Good afternoon. I'd like to start this afternoon by, first of all, thanking Islanders. For so many of you are following the advice, our advice, and that of the Chief Public Health Officer of the country to stay home. Stay at home when you can. If you're self-isolating, you're self-isolating if you've returned from travel. You're practicing social distancing. This is new for all of us, and thank you, because so many people are doing such a good job. And it's so important, because if we continue to follow these measures today, it will impact our situation in the weeks ahead. There continue to be only the 2 confirmed positive cases of COVID-19 in PEI, and both are travel-related. However, what is concern across the country is that in certain parts, they are starting to see community transmission. We have not seen that yet in Prince Edward Island, but based on what we're seeing in other parts of the country, we are introducing enhanced screening measures that we think will make a difference, and we hope will make a difference here in this province. It's based on what we see across the country, but also measures that have been put in place in certain parts of the world that have proved effective. So today, in addition to anyone who has recently returned from international travel, any Islander who has traveled within Canada is being directed to self-isolate for 14 days. And starting later today, screening measures are being put in place at all entry points into our province, including at the Confederation Bridge, the Charlottetown Airport, and the PEI ferry dock in Surrey for the ferry from the Magdalen Islands. We are actively working with agencies and officials to put these measures in place. We understand that people flying into Canada are already being screened at points of entry when they arrive, and our airport measures will be in addition to that. I want to clarify that we are not closing the bridge, airport, or ferry. We are simply setting up screening at each of these entry points for all individuals arriving in PEI, Islanders and visitors alike. This will help to identify anyone who has symptoms of COVID-19, but also reinforce self-isolation messages and information about what to do if you get symptoms. It is important for everyone to comply. I'd like to reiterate some information that was shared yesterday about the Air Canada flight that was linked to our second positive case of COVID-19. Again, it was Air Canada flight 7564, which left Toronto at 9:20 a.m. and landed in Charlottetown at 12:28 p.m. on March 11th. And I need to be clear, all passengers who were on this flight are asked to self-isolate for 14 days from the date they returned. This means to self-isolate and watch for symptoms until March 25th. And should anyone on this flight begin to experience symptoms associated with COVID-19, call 811, and that is true of anyone who is self-isolating or experiencing symptoms. Other thing to mention today, in order to ensure that all Islanders have fair access to the medications they need, the following measure is being put in place effective today. That Island pharmacies will now be limiting all prescription refills to a maximum of 30 days at a time. And pharmacare clients will have no additional financial burden due to the more frequent refills. And I know that government is working on a plan for alternative options to access alcohol in the provincial liquor stores or elsewhere that is not just the agency stores. And I understand that they are finalizing their plan and intend to share that with Islanders very soon. As of this morning, there have been over 300 tests conducted, and the actual detailed numbers, of course, that changes with each test that's done, but those numbers will be updated through the COVID-19 webpage on the website later today. I mentioned social distancing. We're all talking about social distancing, and I'd like to stress that social distancing applies to all islanders and visitors. Think about what we do now will make an impact our whole province in the weeks ahead. But I do recognize with so many people at home, social distancing and in self-isolation, the mental health impacts are difficult to measure. And this is an important issue for islanders. And when we look at these measures, we balance those impacts with knowing that if we take all the precautions now, we may be better off in the weeks ahead. But we miss our friends, and we miss our faith-based organizations or communities or clubs, and we just are trying to feel like we can connect differently as we go forward. There are resources available online and through the COVID-19 webpage to help islanders who are feeling overwhelmed and anxious, and I encourage them to use these resources. And also to the Island Helpline, Kids Helpline, Farmers Helpline, and Canadian Mental Health Association if you need to talk to someone. It is the best interest of islanders that is at the heart of all these really tough decisions that we're making. And we keep saying it and hoping that the actions that we take now will impact what the situation looks like in the weeks and months ahead. And I've been reminded both of this personally, but I think it's for everyone in government and community and families that this is a marathon. This is not a sprint. And we have to be thoughtful of each other, be calm and kind, but take appropriate actions all the way through. And I know it's hard for all of us, but if we work together, we will protect ourselves, our families, and communities. Alors, je vais juste faire en français un peu avant de prendre les questions. Bon après-midi. Je veux commencer par remercier les insulaires à l'île du Prince-Édouard. Ils prennent les mesures d'auto-isolation, des mesures de distance entre les gens et de rester chez eux. Et je les remercie parce que tout ce qu'on fait peut faire maintenant fait une différence dans les semaines qui viennent, les mois qui suivent. On a encore seulement les 2 cas ici à l'île du Prince-Édouard. Et les 2 sont reliés des voyages hors du pays. Mais dans les régions du Canada, il y a des cas qui commencent d'être transmis dans la communauté. On ne voit pas ça ici encore, l'île du Prince-Édouard, mais parce qu'on voit des cas qui sont transmis dans la communauté dans l'autre partie du Canada et on pense aussi à les mesures qui ont fait une différence dans certains pays. On introduit des mesures pour les insulaires ici qui vont peut-être nous aider. Alors maintenant, si les gens reviennent à l'île du Prince-Édouard, même s'ils viennent de notre province, pas seulement hors du pays, il faut auto-isoler pendant 14 jours. C'est self-isolate pour les 14 jours. Et puis, plus tard aujourd'hui, on va introduire les mesures pour vraiment faire checker les gens quand ils arrivent par le pont, l'aéroport et aussi à Surrey pour le ferry des îles de la Madeleine. Et puis, on est en train de travailler avec beaucoup de gens pour que c'est en place plus tard cet après-midi. On sait qu'il y a les gens qui sont déjà, ils arrivent à notre aéroport, mais on répète les mêmes choses ici à Charlottetown. On ne ferme pas le pont ou l'aéroport, mais on essaie de trouver les gens s'ils ont les symptômes de Covid-19 et aussi pour donner l'information de isolation chez eux. À ce moment, il y a plus de 300 tests pour COVID-19 qui ont été réalisés et puis les détails seront mis sur le webpage, le website plus tard cet après-midi. Je vais peut-être juste finir par dire que c'est difficile de mesurer les impacts au niveau mental et anxiété qui est sûr d'être quelque chose pour les gens parce qu'on ne voit pas nos amis ou nos communautés. Mais on fait ça parce que si on fait les précautions maintenant et les mesures de santé publique, ça va faire une différence dans les semaines qui viennent. C'est des choses qu'on fait, ça ne va pas tout arriver aujourd'hui, mais on prend des mesures un jour à la fois et tout en essayant de protéger les insulaires de l'île du Prince-Édouard et de protéger nos familles et la communauté et tous les gens qui habitent ici. OK, merci. I'll open to questions.
Dr Morrison, Julien Lecacheur, Radio-Canada. Première question pour vous. Parlez-moi de ces tests qui vont être faits exactement au pont, à l'aéroport, au ferry, à Souris. Comment ça va fonctionner? Quel est le personnel qui va être sur place?
Alors, chaque voiture, les gens à l'aéroport vont être demandés des questions à propos des symptômes. Et si on a les symptômes, on va prendre le nom et le contact pour qu'ils soient testés pour le COVID-19 et s'ils ont besoin. Et aussi, ça va être fait par les officiaux de santé publique. Alors, on a déjà des gens à l'aéroport maintenant depuis hier qui donnent l'information, mais c'est pas seulement l'information. Maintenant, ils vont demander à chaque personne des questions à propos des symptômes et s'ils viennent d'un certain coin.
Donc, vous me dites que les équipes seront en place au pont et au bateau à Souris dès aujourd'hui.
On ne sait pas à quelle heure, mais ils sont en train de s'organiser. Il y a beaucoup de détails avec les polices devraient être informés, RCMP, les officiaux du pont. Et j'ai parlé à Doug Newsom ce matin à l'aéroport. Alors, ils s'organisent et pour exemple, il y a des vols qui viennent plus tard ce soir et puis on voudrait qu'il y ait quelqu'un là pour demander des questions et faire du screening de chaque personne qui rentre à l'île du Prince-Édouard.
Pour terminer, comment allez-vous vous assurer que tous les insulaires ou que toutes les personnes qui viennent d'en dehors les provinces respectent les 14 jours, les 14 jours d'isolement? Comment vous allez pouvoir vous assurer? Certaines personnes pourraient être amenées à ne pas respecter cela.
Et puis, on est en train de discuter ça avec même un ordre. Je sais qu'il y a d'autres provinces qui maintenant prennent des mesures si personne, s'ils trouvent quelqu'un qui ne respectent pas le 14 jours, ils vont les suivre vraiment. Et puis, on est en train de discuter qu'est-ce que ça veut dire ici à l'île du Prince-Édouard.
Merci.
Docteur Morrison, Laurent Rigaud pour la Voix acadienne. Il y a quelques jours, vous avez évoqué très rapidement le fait que le virus pouvait survivre quelques heures à l'extérieur sur des surfaces. Est-ce que vous pouvez nous en dire un peu plus? Est-ce que les insulaires doivent faire attention quand ils achètent à l'épicerie? Est-ce qu'il faut désinfecter les bouteilles ou certains produits? Comment est-ce qu'on peut se prémunir contre ça?
Et puis, on trouve toutes sortes. Chaque jour, il y a plus de recherches à propos du virus Covid-19, mais ça peut vivre quelques heures jusqu'à quelques jours sur les surfaces, dépendant le type de surface. Alors, c'est un exemple. C'est très important de laver les mains avant que vous touchez quelque chose, et après que vous ouvrez quelque chose, lavez les mains. Et puis, on est en train de mettre même sur le site web des instructions qui peut-être peut aider les gens quand ils sont en train de amener la nourriture chez eux, qu'est-ce qu'ils peuvent faire un peu plus exact pour cette raison.
Merci.
Travis Kingdon from the CBC here in Charlottetown. Curious to know what the screening at those points of entry will look like. Are people going to be taking temperatures or asking questions, or what's that kind of going to look like?
So at the point of entries, it will be questions about symptoms that they've had or that they have, and and now everyone, whether it's out of country or out of province, will be asked to self-isolate, will be directed to self-isolate, and so there'll be questions about your health, and then if anyone has any symptoms, they will have contact information taken, and they will be then directed for testing. And if they, it's also a chance to really give out that information about self-isolation. What does it mean? It does not mean you go to the grocery store and stop to have something to eat somewhere. It's really about staying at home, and there'll be information about what self-isolation means. So we are getting those printed out to make sure we have enough copies, etc., in English and French. So it'll be information what to do if you do get symptoms, and stressing the importance individually with every islander coming in, but also checking for symptoms. And the hope is also to do temperature checks as well. We know that not everyone who has COVID-19 symptoms has a temperature, but we will be doing that as much as possible. And we're just trying to secure the equipment we need, but that will be in place as soon as we can.
And then I'm curious about when this kind of takes part. Does this start now, or should people who have arrived back in the past week or so self-isolate from domestic travel?
I mean, I think that's a really good question. My advice would be anyone who's come back in the last few days, and anyone who's come back with international travel should be self-isolating, and that's been clear for definitely the last week. So that's clear. If you've returned from out of province, I think it may be a little bit on a risk assessment, but I think right now anyone going forward needs to self-isolate, and certainly if you've been in any kind of community which has had increased spread or community spread of COVID-19, we would like you to self-isolate for that total of 14 days.
Last week, you kind of don't need to self-isolate at this point, no?
I mean, if you came back from New Brunswick last week and there's been no significant community spread there, you would maybe continue on. You're still being advised to stay home and watch for symptoms, and I think that is was the direction at the time, but certainly going forward, that is the direction.
And then I'm curious to know about travel between Nova Scotia and New Brunswick as well, what that means for those people there. Is it just places where there's high levels of community transmission?
Our information is being to anyone who comes to PEI.
Could you give a firm start date of when domestic travel should start self-isolating?
Today.
Perfect. Thank you.
Yes.
Hi, Mike Rover at The Guardian. I'm just wondering what enforcement options might be available to you for those who aren't self-isolating, particularly perhaps with frontline workers at a grocery store or something. I know there's been statements out from Sobeys and Superstore about precautions that they are taking, but are you doing anything to make sure those precautions are being taken? And again, what sorts of consequences might those companies face if they aren't taking necessary precautions for social distancing?
And those are absolutely the questions that I think the whole country is trying to figure out. I think at this point in time, when we've had calls and we've had questions and we've had complaints and we've been following them up and trying to discuss that with a business or a business owner, or we've heard from certain employees and we've been trying to follow those up. And so we will continue to do that. I think, as we've seen in some of the other provinces, they are starting to look at more enforcement if they find people who are not self-isolating. In a couple of the bigger provinces, then there is law enforcement who is coming in to help make that clear.
So do you foresee that on the island here?
Certainly in discussion today. But I think that is a process, and I have been, I started the statement today being so pleased and proud and thankful to Islanders because I know they all want to do. So many are doing things that they've never had to do before: stay at home, self-isolate, social distance, and I know they'll continue to do that for the sake of their families and their community. It's a balanced use of authority. Those that aren't complying, we will want to deal with because they put others at risk if they are not doing the self-isolation that they've been asked to do. So it is an ongoing and current discussion.
Okay, and also, you may not have an answer to this yet. It was only announced earlier this morning, but the federal government mentioned that they're increasing efforts to repatriate Canadians abroad, specifically in Peru, Mexico, and Spain. I was wondering if you knew if there were any Islanders on those lists and what sort of procedure they would have to follow to get back in the country at this point.
No, and so I'm not sure. I don't have a list of any Islanders from those repatriated areas or flights, but we may learn more in the days ahead.
Okay, and also just a quick update on, I know you mentioned earlier in the week about about starting testing for COVID on the island here. Is there any update to how close we are to that?
So in terms of, we have actually one of the testing sites is now moved to a drive-through site, and they're working on doing the same for the Charlottetown site. And so we're continuing to do those testing there, and we've also have a protocol in place for the community paramedics, and who will also be able to do testing at someone's home, for instance, if they don't have a driver's license and need to be tested. And so that's probably the update I have at this point in time in terms of the testing.
So no movement insofar as not having to send them away to the lab in Winnipeg for presumptive confirmation? We're still just having to send them away?
Yes, no. So I don't expect our PEI to have our own capacity, at least for a couple of weeks. So, but I am, so I don't have a start date for that, but that continues to be an issue. But we do have, we're continuing to test people and send those off, but it means that there is probably an extra day or so, day or two delay in getting our tests back.
Okay, thank you.
Thank you.
Docteur Morrison, je reviens en français, je m'excuse. Juste pour être sûr, vous avez dit 300 tests, 2 positifs, mais est-ce que vous avez les chiffres des négatifs et des en attente, pending?
Tous les détails, ça change tellement vite parce que on était en train d'avoir un clinique ce matin pour les tests. Alors, les détails des numéros seront sur le site, le website plus tard aujourd'hui. Je pense que les numéros qui sont là sont de 4 heures hier après-midi, et puis mais ça change à cause du clinique ce matin. Mais ça, les nombres, les négatifs et les nombres qu'on attend devraient être là plus tard cet après-midi.
Merci.
Merci. Okay. Merci beaucoup. Thank you.